Hello guys, welcome to the channel again. Today we're gonna have another edition of frequently asked questions in the clinic. And today we're gonna talk about urinary tract infections or UTIs. Most commonly, they happen to women rather than men. And the reason is because women have a shorter urethra. Urethra is the tube that connects the bladder to the outside. So because men have penises, we have a longer urethra. So the hypothesis, the thinking is it takes longer for bacteria to crawl up the tube into the bladder and cause an infection. So that's why we think that women are more prone to it. Another hypothesis is that the end of the urethra is very close to the vagina, which contains bacteria. So those are kind of the hypotheses as to why women get more UTIs than men. So things that I commonly hear is, or things that I get commonly asked, is about how to prevent them, because there are some women that have recurrent UTIs. Others just get really bad UTIs when they get one, and of course they don't want to go through it. So what I always tell them is, of course, drink plenty of water. You can also drink cranberry juice. There's some evidence that cranberry juice does help with ureasis and cleaning your kidneys, for lack of a better word. Another thing is, of course, making sure that you wipe up down instead of down up. Again, the thought process is that by wiping down and up, you are introducing bacteria into the urethra. So always make sure you wipe up down. And another common thing, in particular I see this in young women, it's making sure that you pee after you have intercourse. There's actually a common name for this in the medical field. We call it honeymoon cystitis. Again, the thought process says that, couples go to their honeymoon, they're having a lot of intercourse, and then when they come back, the woman has a UTI. And again, the thought process about that is during intercourse, you have more exposure. You're exposing the urethra, opening the end to more bacteria. So that's always something to keep in mind. In men, the treatment is very easy and very common, depending on the antibiotic. It's usually 3 days to 5 days of antibiotic. In men, if a man gets a UTI, it's a little bit more complicated, again, because it's not that frequent. There is a higher risk that there might be also prostate infection involved if we let it linger for a little bit. Another thing could be another thing that it could be is because of sexually transmitted infections. So the workup for men, it's a little bit more complex, even though it's not a big deal compared to women. Another thing to keep in mind is what are the symptoms that will make me refer you to the emergency room. So that is nausea and vomiting, and you're unable to keep fluids or your medication down. So if we let it linger for a little bit, or if it is a very aggressive infection, the bacteria can travel from the bladder all the way to the kidneys, and we call that pyelonephritis. So that's infection, inflammation of the kidneys. And usually the patient can get really, really sick with that. You start having flank pain, you start having fevers and chills, you feel nauseous, and that's why you start having the vomiting. So if you get to the vomiting point, you definitely need to the emergency room. If you're just having the fevers and chills and have the flank pain, we can see your clinic, because hopefully we still have time to act and give you the antibiotics that you need and make the infection go away. So just remember that if you have fevers, chills, and flank pain, that's a kidney infection. If you're just having burning or pain with urination, increased urinary frequency, that's an infection mostly of the bladder. If you have vomiting, then we need to go to the emergency room. Well, I hope you found this video helpful, guys. Let me know if you have any questions, any comments. I'm always interested in hearing your feedback. I hope you have a great weekend and see you later. Bye.